Hi, this is my Peripheral Vascular Week 3 video. I'm going to go in and assess my patient who has peripheral arterial disease. Before I go into the room, I'm going to wash my hands. Not covered. Hi, I'm Lexi. I'll be your nurse today.
Okay. I'm Allie.
Okay, Allie, can you verify your name and birthday for me?
Allie Merritt, May 10th, 2002.
Okay. Do you have any allergies, Allie?
No.
Okay. What brings you in today?
So I've been trying to go on walks, and as I'm going on walks, my right leg cramps up, and it only goes away after rest.
After rest? Okay. So, how far can you walk?
Quarter of a mile.
And then can you describe the pain a little bit for me?
Just tight cramps, and it hurts a lot.
Okay.
To put pressure.
Okay. So can you point to me on your leg where it hurts at? Okay, right in there. Okay, Allie, I'm gonna do a little bit more of an assessment. I'll ask you a few more questions and then we'll see what we can do, okay? Do you take any medications?
I do take,
right
birth control.
Birth control? Okay. Do you smoke at all?
I do.
You do? Okay. Can you tell me about, what you've eaten the last, 24 hours?
I eat quite a bit of fast food, like McDonald's, and then a lot of caffeine.
Okay. I'm gonna say, how many times a week do you think you go out and eat fast food?
4
times a week? Okay. Alright, Allie. Let's see. I'll have you turn to the side of the bed, and I'm going to just listen to your lungs and your heart. Actually, you can turn the other way so I can listen to your back first. Sorry. Okay, so every time I move my stethoscope, I'm just going to listen to your lungs, and then every time I move, I want you to take a big, deep breath in.
Okay.
Deep breath in, and out. In. Okay, I'll have you turn over to the side. And I'll do the same thing on this side. Big deep breath in. Okay, and I'm going to do the same thing. You can breathe normally, but I'm just going to listen to your heart, okay? Listen to your heart in 5 places. Start over here with the aortic. Pulmonic valve. Erb's point. The tricuspid. And the mitral valve. From here, I'd listen to the apical pulse for 1 full minute, but to save time, I'm not going to do that now. Then I'll turn my stethoscope around, and I'll listen for any murmurs or any breeze. Same 5 spots. Okay. And at this point, I would take a set of vitals, but for right now, I don't have any of that equipment, so I won't be doing that. And also, I would be listening under a shirt, but to save privacy for my client, I won't be doing that. So now I'm just going to get into the peripheral vascular assessment. Let me take these off. So I'm going to start with the upper extremities and just palpate the pulses. Okay. Pulses are 2+ bilateral. Okay, and then I'll go into your brachial. Okay. Upper extremities are warm, cool to touch. A little bit of clubbing noticed on the fingers. pulses are equal and bilateral. Alright, now I'm going to have you lay back down, and I'm going to look at your carotid artery. So I want you to lay flat first, and then I'll have you sit back up. Okay, so then just kind of keep your neck straight. So I'm looking for jugular vein distension, and I don't see any noted, so then I'll have you sit back up and raise about 30 degrees. And I'll have you look side, and then look that way. Okay, so no jugular vein distensions noted. I'm just going to palpate. Just one at a time. I don't want you to pass that on me. Okay, and then strong 2+. Take a listen. Ready, bruise. Okay, no bruise are noted. And then we're just going to work our way back down the legs, checking out the lower extremities. I'll have you lay flat here for just a second. And here, again, I would feel for the femoral pulses. Again, provide privacy. You can do that. Okay, I want 2+, and I'll have you bend your knee. Actually, I should have done that first. That's okay. I'm going to start back down the feet, actually. You still see me. Okay, so I'll have you feel for your pedal pulses. Okay. So her pedal pulse in her right leg is a little diminished. The left leg still is about a 2+. The right leg's about a 1+. It's a little thready. Go in, feel. You're so long. Just hit me with the back. Anterior tib or posterior tib pulses. Same thing, just a little diminished on this right side. Okay, I'll have you bend your leg or bend your knee. There you go. I'm going to feel for the popliteal pulse. A little harder. Oops, still diminished. Have you raise this leg. Okay, good. So then as I'm inspecting the legs, I notice this leg has a little bit of diminished hair growth. She's a little cooler to touch on this side compared to her right. Skin's kind of dry and flaky. Let's do a little cap refill. Okay, cap refill is a little delayed, about 4 seconds on the right, and about 2 here on the left. The skin's just looking a little drier on this side. She had mentioned intermittent claudication, so signs of PAD. You can sit on. So for interventions for PAD, I would recommend to the healthcare provider that she get antihypertensives. She would get antiplatelets, maybe get put on an anticoagulant like warfarin. I would have her make sure that she's not elevating her legs, but keeping them, like while she's taking a rest, I would have her keep her legs at a level surface because we don't want the blood to pool, because we need the blood to perfuse down to the legs. Avoid anti-embolism stockings. We'll do diet modifications, maybe lipid-lowering agents like a statin, and smoking cessation. So I'd educate her on quitting smoking. And yeah, I think that's it. Do you have any other questions? No. Okay. Thank you. Here's your call light. Here's all the good stuff. Let me know if you need anything.